Having a baby is usually such a happy time, a moment most families treasure. But what if out of the blue you find yourself feeling anxious, irritable, or sad? What if you're just not feeling like yourself for an abnormal length of time? Well, according to clinical professionals, this type of anxiety and depression is more common than you may think and can appear before or after pregnancy. Here's one Fresno woman who recognized how important it was to seek help when depression threatened.
You'd never know Deanne Toslian, the mother of two energetic boys, had a difficult time after her children were born.
When my first son was born, I felt really detached from him. Here, I had a baby. It was supposed to be this great thing, this gift. I was supposed to feel really blessed.
She knew something was really wrong when the feelings didn't go away.
When he was about 6 months old, I realized that maybe I needed to talk with someone about how I was feeling. Didn't really feel normal anymore.
Deanne wasn't experiencing the joys of motherhood, and she wasn't bonding with her son.
I just didn't really want to spend a lot of time with him. It was okay. I nursed. I did what was right for him. I did what I felt, out of duty. I'm a good mom. I'm nursing. He's getting, the best that he can get.
All classic signs of postpartum depression, says marriage and family therapist Patricia Neufeld.
But if she's not enjoying this, whether, she may think, well, that's just part of, being a mom. No, you deserve to enjoy this. Pick up the phone, get the help you need. You'll feel a lot better. You deserve to have many moments of joy during this time.
So Deanne sought professional help.
So I talked to my doctor, my OBGYN, who knew a little bit of my history. Well, at least, I'd been seeing him since I got pregnant. Staples for the machine are right down here. I just told him that I didn't feel right. Told him how I was feeling.
Deanne was able to advocate for herself, but Patty says this does not always happen.
For most women, though, pregnancy and postpartum depression is not diagnosed and it's not treated, and they fight through it. And it becomes very torturous for them. They feel very overwhelmed, and life becomes very, very hard for them. They feel profoundly alone, disconnected, and it takes months and sometimes years to get over it.
That's cross-section of the abdomen.
Dr. Conrad Chow, Chief of OBGYN for UCSF Fresno, explains some symptoms to watch for.
This is something where patients actually go into not just feeling down or sad, but something of a clinical depression.
Dr. Chow says it goes beyond just having a bad day or two.
And this would have features of clinical depression, feeling sad about everything, no longer taking pleasure in things that you did in the past.
Patty also stresses postpartum depression can be addressed even before women give birth.
Women who already have anxiety and depression disorders before they get pregnant should be followed by a psychiatrist, should be followed with a psychotherapist as well, because they are at high risk for having it worsen during pregnancy.
I grew up with a family history of depression, so I was already comfortable talking about it. I knew it was serious.
Patricia says if you have a history of depression, talk with your doctor before having the baby.
Having current depression, anxiety during pregnancy predisposes you to postpartum depression. So it's important when you're pregnant to get treatment so that you don't have postpartum depression.
Deanne didn't have a problem during her second pregnancy because of her advocacy and doctor's foresight.
But talk to somebody about it. You'd be surprised at how many of your friends or how many other women you know are experiencing the same feelings.
They deserve to have the treatment. They deserve to have a life that's worth living. This is not something that you should be embarrassed about. This is an illness that deserves treatment, and with treatment, it's very effective. So with treatment, you can get better. And don't wait 6 months. You don't have to suffer or struggle with that alone for that many months. It shouldn't last that long. I have two beautiful sons. They're 5 and 2.5 now, almost 3. And we have great fun together. I enjoy them. They are the blessing. They are the gift that I thought I was supposed to feel like they were when they were born. It was all worth it. Yeah.
Good for Deanne and her family. Remember, anxiety and depression can appear before and after pregnancy, so don't wait to talk to your doctor if you're just not feeling like yourself. For more information, log on to our website. It's medwatchtoday.com.